Adam Schayek here with Real-Time Neurology. Today, I'm joined by Patty Bobryk, a physical therapist at the Orlando Health MS Center. Patty, can you tell us a little bit, how's CMSC been going, and have you seen a lot of rehab staff here, and kind of how are we working together with the doctors?
Yeah. The CMSC annual conference is always a great place to meet and greet all professionals who are taking care of folks with MS. Rehab has a huge presence here, and we're shoulder to shoulder with all the other team members. And I don't know of any other conference that has the neurologists, the rehab professionals, social work, researchers, clinicians, all at one conference, and that can collaborate and network as we do here at the CMSC conference.
Yeah, and I'll say from a physical therapy perspective, as a new grad, I've already learned so much more about multiple sclerosis as a whole, but also from a diagnosis perspective, other great ideas from OT staff, PT staff, doctors. It's been great.
Yeah, I have to agree with that. It's such a great learning experience, and not only in your own discipline, but learning about what everybody else does. And because MS is so complicated and complex, it's what you know about everything else outside of your discipline that really makes you an expert and able to care for the patient completely and comprehensively.
For sure, and it's also knowing with that information when to refer which direction, if it's from MD to PT or PT to MD. And I learned a lot this morning from the occupational therapist about all the behavior modification that can be made, and a lot about tech. What did you think of the presentations this morning?
I thought that they were excellent. The occupational therapists did a very, very good job at giving us a comprehensive overview of behavior interventions for all the symptoms that we might be encountering. Whether or not you're an OT, there were a lot of strategies that you could take away and use in your own practice. We had Matt Sutliff this morning talking about computer-based outcome measures, which is a new cutting-edge technology, and we're going to see what the future is going to bring for that. I think that it is really great that we understand what everybody else's profession is doing so that we can work more collaboratively and shoulder to shoulder. And we always say that we're multidisciplinary, and I think that we're more transdisciplinary. There's a lot of blurring of the borders. We're all still practicing within our scope of practice, but there's a lot more collaboration and saying, we need to address this symptom of fatigue. Well, I'm going to address it kind of from a functional standpoint. I'm going to address it from a medication standpoint. I'm going to address it from a walking standpoint, so that we all have our roles, but we're all working towards the end goal.
Absolutely. And I think this morning a great example of that was talking with the occupational therapist about one of those behavior change modifications can be diet. And I asked her, how far into diet do you normally go? And she's like, mostly just the basics. And if they really want to make this big change or do something that's outside of what the norms are, that's when a referral happens. And that's great. And that's how we should be doing it.
I think the other thing, too, is that besides our therapy interventions is that we have a great focus on health and wellness in caring for this patients with MS. So, that fits in right in line: nutrition, sleep hygiene, hydration, all of those things fall within our realm, but also have to do with healthy living.
Absolutely. Patty, I want to thank you so much for joining us today, and I want to thank you at home for watching Real-Time Neurology.